this is Joanna IVM Ramos from BSN2 Block D of the College of Nursing, Nueva Ecija, University of Science and Technology. For today's video, I will be performing the acetic acid test solution. For the assessment, areas, points to be assessed during acetic acid testing. First, determine the need for acetic acid test. Assess the client's overall condition. Determine when the client last voided or when last tested for urine analysis. Here are the things that we need to determine. Determine if there is a near barangay health unit for more comprehensive testing. Next, if there is a history of hypertension, diabetes, or preeclampsia in the family. For the planning, prepare all the equipments needed. CHN or OB bag. Allow adequate time to perform the urine testing. Next, this must be performed during a home visit. Here are the equipments needed. Sterile urine specimen bottle, Benedict's test solution, test tubes, test tube holder, alcohol lamp, denatured alcohol, matchbox, newspaper, dropper, and clean gloves. For the implementation, prior to performing the procedure, introduce yourself and verify the client's identity. The rationale for doing this is for us to know if we are handling the right client. Next, explain to the client what we are going to do, why is it necessary, and how he or she can participate. The rationale for doing this is that our client will understand what will the procedure that we will perform to them. Next is observe for infection control procedures. The rationale for doing this is to minimize the spread of the microorganisms. Next is to provide for the client's privacy, for the comfortability of our client during the procedure. Next is to spread the newspaper for the bag to rest on. Place on a steady dry place away from the sunlight and garbage. Unbutton the bag, take out all necessary equipments needed. The alcohol lamp with denatured alcohol, test tubes, test tube holder, matchbox, Benedict solution, and acetic acid. They will also be needing the Benedict solution and the acetic acid solution. The alcohol lamp and the matchbox. Hand the sterile specimen bottle to the client, then ask the client to have a midstream catch of the urine specimen. Fill the test tube with a urine sample for about 2/3 of the test tube. Hold the test tube with the test tube holder facing away from you. The rationale for doing this is that if the bottle explodes, it will not go into your face. Use the alcohol lamp, heat upper 1/3 of the test tube constantly. few drops of acetic acid alongside the test tube. Heat the test tube with the alcohol lamp and then wait for it to boil. Now we are going to add few drops of acetic acid to the solution. For precipitation. If precipitation disappears, it is because of the presence of phosphate. If the precipitate remains, it means it has presence of albumin in it. It should not disappear with acetic acid. Number 10. Note for the results of the urine. If the urine is highly alkaline or highly acidic, the results are invalid. So as we see, the results are negative. For the evaluation, we assess and evaluate the comfort of the client after the nursing care. Notify the healthcare facility responsible regarding the results. Next, perform a detailed follow-up based on findings that deviated from the expected or normal for the client. Next, teach the client how to do proper follow-up and provide other appropriate instructions. Documentation. Document the procedure, including the tests performed and results in the client's record using forms or checklists supplemented by narrative notes when appropriate. Next, record the findings and nursing care given. And then lastly, make an appointment either for a clinic or a home visit.